Welcome. I, Dr. Sunil Nathamaske, Dean Dr. Vithoda Vike Patil Foundation's Medical College and Hospital Ahmednagar introduces you in new lecture series. Not only medical practitioners, but also all Indians should know about these medical notables who contributed in medical fraternity. There are n number of notable females who contributed through medical field, but few of them I am going to highlight in front of you. One of the female pioneer in medical fraternity everyone knows is Dr. Anandi Gopal Joshi. She was the first female of Indian origin to study and graduate with a degree in medicine in the United States. She was born in 1865, 31st March. She was one of the first Indian female doctor of Western medicine alongside Kadambini Ganguly. She was the first woman from the erstwhile Bombay Presidency of India to study and graduate with a 2-year degree in Western medicine in the United States. Anandibai Joshi was a torch bearer of movement that led many more Indians, especially women, to access education at par with their colonizers. Dr. Joshi unfortunately lived mere of 21 years, but achieved so much in that brief span that a crater on Venus has been named in her honor. The 34.3 kilometer diameter crater on Venus named Joshi, which lies at latitude of 5.5 degree north and longitude 2.88.8 degree east. Unfortunately, her professional life was very short-lived, and because of illness, she died at the age of 22 on 26th February 1887. Her husband, Mr. Gopal Joshi, has sent her ashes to USA in the New York, where her cemetery is created, which is shown in the photograph. After Anandibai Gopal, everyone should aware about the Rukhmabai Raut. She was born on 22nd November 1964. Rukhmabai was born in Marathi family, and in 1894, Rukhmabai received Doctor of Medicine from London School of Medicine for women, having also studied it at Royal Free Hospital. She is best known for her being one of the first practicing woman doctor in colonial India, as well as being involved in a landmark legal case involving her marriage as a child breed between 1884 and 1888. Rukhmabai, the second woman to both receive medical degree and practice in medicine. She died at the age of 90 from lung cancer on 25th September 1955. After Rukhmabai, third pioneer woman who contributed in medical fraternity is the Kadambini Ganguly. She was one of the first Indian female doctors who practiced with a degree in modern medicine. She was the first Indian woman to practice in India. Kadambini Ganguly was the first woman to gain admission to Calcutta Medical College in 1984, subsequently trained in Scotland, and established a successful medical practice in India. She was born on 18th July 1861 at Bengal Presidency, now in Bihar, during the time of British Raj. Kadambini Ganguly married to Dwarkanath Ganguly on 12th June 1883, just 11 days before joining Calcutta Medical College. As a mother of 8 children, she had to devote considerable time to her household affairs. She was one of the first women graduates from India and entire British Empire who moved on to become one of the first female physicians trained in Western medicine in whole of the South Asia. Kadambini's busy life as a doctor and mother of 8 children did not stop her from playing a role in India's women's rights movement. She was one of 6 representatives in the first female delegation of 1889 Indian National Congress, and in 1906, she helped to organize the Women's Conference in Calcutta. She was also extremely active in many other movements, like one of the fought to improve work conditions of female Eastern Indian coal miners. Until the day she died, she did not turn down any of medical call. Kadambini Ganguly died on 7th October 1923, 15 minutes after returning from one of her regular medical call. Unfortunately, she left the world before any medical aid could reach her. After Kadambini, next one is the Muthulakshmi Reddy. She was an Indian medical practitioner, social reformer, and Padma Bhushan awardee. Muthulakshmi Reddy was born on 30th July 1886 in the princely state of Pudukottai of Tamil Nadu. In spite of various constraints faced by girls in India of her time, she completed her higher education and was admitted into the medical profession. In 1907, she joined the Madras Medical College, where she achieved a brilliant academic record. With several gold medals and prizes to her credit, Reddy graduated in 1912 to become one of the first female doctors in India. Soon after, she came under the influence of Annie Besant and then of Mahatma Gandhi. Muthulakshmi Reddy was appointed to the Madras Legislative Council in 1926. This nomination marked the beginning of her lifelong effort to correct the balance for women, for removing social abuses, and working for equality in moral standards. She was women's activist and social reformer. There are a number of firsts on her name. She was the first female student to be admitted into the male's college. She was the first woman house surgeon in the government maternity and ophthalmic hospital. She was also the first woman legislator in the British India. Dr. Reddy was the first chairperson of the State Social Welfare Advisory Board. Also, she was the first woman in the world to become the vice president of her legislature. Dr. Reddy, the first woman deputy president of Legislative Council, and also was the first elder woman of Madras Corporation Away Home. She was the prime mover behind the legislation that abolished the Devadasi system and played a keen role in raising the minimum marriage age for women in India. Dr. Reddy died on 22nd July 1968. Then Dr. Bano Jahangir Koyaji. She was born in Mumbai on 7 September 1917 into a Parsi family. She went on to do pre-medical sources at St. Xavier's College and then studied medicine at Grand Medical College, where she graduated with a MD degree in 1940. Banu trained to become a gynecologist during her residency with the renowned Dr. V.N. Shirodkar, but pursued general practice under Dr. Edolji Goyaji when she returned to Pune in 1943. She also transformed KM Hospital into a teaching hospital and a research institute and established an affiliation with BJ Medical College. Dr. Koyaji has contributed in the areas of family planning, urban and rural health, and children's health. For her all the work, she was awarded in 1989 with Padma Bhushan, Padma Award, Padma Bhushan, in 1992, Punya Bhushan Award, and in 1993, Raymond Magsaysay Award for her public service. Dr. Bano Koyaji died on 15th July 2004. Gurubai Karmarkar. She was the second Indian woman to graduate from the Women's Medical College of Peninsula in 1886. Gurubai Karmarkar returned to India in 1893 after receiving her medical degree. She worked for 23 years at the American Marathi Mission, a Christian establishment in Bombay. Her medical work focused mainly on the most disenfranchised members of the Indian caste system. And a prominent group in her practice were the women of all the castes. Dr. V. Shanta. Shanta was born on 11th March 1927 at Chennai into distinguished family that included two Nobel laureates, namely her granduncle, Dr. C. V. Raman, and her uncle, Dr. S. Chandrasekhar. She was an Indian oncologist and the chairperson of Adar Cancer Institute, Chennai. Dr. Shanta was the best known for her efforts towards making quality and affordable cancer treatment accessible to all patients in India. Dr. Shanta dedicated herself to the mission of organizing care for cancer patients, study of the disease, research on its prevention and cure, spreading awareness about the disease, and developing specialists and scientists in various subspecialties of oncology. Dr. V. Shanta was an elected fellow of National Academy of Medical Sciences, and for her whole oncology-related work, she was awarded from Government of India in 1986 by Padma Shri Award, in 2006 by Padma Bhushan Award, and in 2016 by Padma Vibhushan Award. Also in 2005, she was awarded with Raman Magsaysay Award. Dr. V. Shanta died on 19th January 2021. Dr. Iyer Padmavati. Dr. Padmavati was India's first female cardiologist. She received MBBS degree from Rangoon Medical College, Rangoon, and later moved to London in 1949, where she received FRCP from Royal College of Physicians, followed by FRCPE from Royal College of Physicians of Edinburgh. She set up India's first cardiology clinic in North India's first cardiac catheter lab and first cardiology department at an Indian medical college. She started first DM in cardiology in India. Dr. Padmavati, even at the age of 101, was served as director of Delhi National Heart Institute. She was the founder president of All India Heart Foundation. Dr. Padmavati was awarded Padma Bhushan, India's third highest civilian award, in 1967, and Padma Vibhushan, India's second highest civilian award, in 1992. Padmavati, an elected fellow of National Academy of Medical Sciences, died on 29th of August 2022 because of COVID-19. At the age of 103, till her death, she was the oldest living doctor in India. Dr. Indira Hinduja. Dr. Indira Hinduja is a Mumbai-based gynecologist, obstetrician, and infertility specialist. She is known for delivering the first test tube baby in India in 1986. She also pioneered the gamete intrafallopian transfer technique, that is the GIFT technique, resulting in the birth of India's first GIFT baby in 1988. In 2011, she received the Padma Shri Award for oocyte donation technique for those suffering from menopausal and premature ovarian failure. Dr. Kadambini Raut. She is the Bangalore-based gynecologist, contributed immensely to assisted reproduction in India. Her specialization include reproductive endocrinology, ovarian physiology, and assisted reproductive technology. She is credited with the birth of India's first semen intrafallopian transfer baby. She was awarded Padma Shri Award and for South India's first semen bank and engineered the country's first babies born through intracytoplasmic sperm injection and laser assisted hatching technology invention. Dr. Firuza Farooq. She gave India, in fact the whole of the Southeast Asia, its very first intracytoplasmic sperm injection baby in 1994. The procedure has till date helped many infertile couples. Dr. Firuza Farooq was also established India's first IVF center. Dr. Manjula Angnani. She is MD, gynecologist, obstetrician, infertility specialist, and laparoscopic surgeon. She received MD from Osmania Medical College, and she was one of the first women doctor to be trained in laparoscopy in 1990s. She has performed over 10,000 laparoscopic operations, has a laudable work in the field of amenorrhea. She is also credited for using stem cell for regenerating endometrium. She has initiated a campaign by the name of Suyosha, a perfect woman. This deals with all aspects related to the well-being of women, that is education, child abuse, discrimination in the education of girls, children, etc. Angnani received Padma Shri Award from President of India in 2015. Dr. Ketan Dinshaw. She graduated from the Christian Medical College, Vellore. Her field of specialization was radiotherapy and oncology, in which she received training from Cambridge. Dr. Dinshaw served as a director of Tata Memorial Hospital for 13 years. She worked tirelessly and is the architect for establishing the Advanced Center for Treatment and Research and Education in Cancer, which is the state-of-the-art research and development satellite of the Tata Memorial Center. She was the president of International Society for Radiation Oncology. Dr. Dinshaw also contributed towards a number of NGOs like the Women's Cancer Initiative and VCare. For her whole contribution in the oncology, she was awarded Padma Shri Award, and she died on 26th of August 2011 because of malignancy. Dr. Subhadra Nair. In the initial days of her career, she worked as an assistant surgeon at Sri Avetam Hospital from women located at Trivendrapuram, the state capital of Kerala. She got her master's degree in gynecology and obstetrics from Patna and Madras University. She is credited with 50,000 of childbirth. She received Padma Shri Award, and she is the first gynecologist to receive such a Padma Award. She has worked tirelessly to open old age homes and homes for destitute children. Dr. Professor Armida Fernandez. She retired as a dean and head of the department at Lokmanya Tilak Medical College. She is a founder trustee of Sneha and NGO working on health, nutrition, and violence in Mumbai urban slums. She also works as a medical director of Holy Family Hospital, Mumbai. Her key areas of expertise and interest are promotion of breastfeeding. And she was credited to start first human milk bank in Asia and has developed many low-cost techniques for survival of the newborns. Dr. Mary Ponan Lukos. She was the Indian gynecologist and obstetrician, first female surgeon general in India. As an Indian university did not offer admission to women for medicine, she moved to London and secured MBBS from London University. Dr. Lukos was the first woman from what would later become Kerala to graduate in medicine. She continued in UK as a MRCOG training and also taken the training in pediatrics from Great Ormond State Hospital. She was the first woman legislature in the state and first woman to be appointed as a Surgeon General in India. She was the first woman Surgeon General in US also. For her contribution in medical fraternity, Government of India has awarded the fourth highest Indian civilian award of Padma Shri in 1975. Dr. Lukos died on 2nd October 1976 at the age of 90. Dr. Mary Verghese. She was the earliest pioneer of physical medicine and rehabilitation in the country. She had her graduate training in medicine at Christian Medical College, Vellore, in between 1946 to 1952. She started Rehabilitation Institute in 1966 and headed the first fully functional physical rehabilitation unit in the country. She was involved in providing rehabilitation services primarily for persons with spinal cord injury, leprosy, and brain injury. After graduating her and some of her college colleagues, along with the head of gynecology, Dr. Carol Jameson, they were traveling in a car And it was then where she was injured in a road crash accident happened in 1954, which resulted in complete spinal cord injury, and she became paralyzed from the below waist down. She continued to work at this phase also in the Christian Medical College, and for her contribution in medical field, she was awarded in 1972 with Padmasri Award. Dr. Verghese died in December 1986 at Vellore. Dr. Menon. After graduating in medicine from Madras Medical College in 1951, she did her residency at Arvind Hospital, New Delhi, before joining the Madras Medical College in 1951 to start her career at Pithampuram Mission Hospital, Andhra Pradesh. She simultaneously studied the postgraduate degree of MD, which she obtained in 1957. Subsequently, Dr. Menon successfully completed Diploma in Psychiatric Medicine at the National Institute of Mental Health and Neurosciences, that becoming the first woman psychiatrist in India. The government of India awarded her third highest civilian honor of Padma Bhushan in 1992 for her contribution to the society. She died in Chennai at the age of 98 on 5th December 2021. Dr. Suniti Solomon, born in 1938 and studied medicine in Madras Medical College and was then trained in pathology in UK, US and Australia. She was an Indian physician microbiologist who pioneered AIDS research and prevention in India after having diagnosed the first Indian AIDS case among the Chennai sex workers in 1985, along with her student Selappan Nirmala. She founded Vair Gaitonde Center for AIDS Research and Education in Chennai. The Indian government conferred the National Woman Bioscientist Award to her. On January 25, 2017, the government of India awarded her Padma Shri for medicine for her contribution toward diagnosis and treatment of HIV patients. Dr. Kshama Maitre, popularly known as Dr. Didi, she is an Indian rural development leader and a pediatrician who has led to the Chinmay Organization for Rural Development, that is the QUAD, since the founding of its predecessor organization in 1985, and she leads the organization as its national director. The operation of this mission is to serve the rural areas of India with its unique approach for sustainable and comprehensive community-driven integrated development program under the aegis of Chinmaya Mission. She also served as advisor to QUAD in USA, the US wing of the organization. She was the recipient of several awards, including Guardian International Development Achievement Award. Also was selected as a Woman of the Year by the Week of magazine in 1993. The government of India awarded her fourth highest civilian award, that is the Padma Shri, in 2008 for her contribution to the society. Dr. Neelam Clare, she is the Indian neonatologist known for her pioneering work on neonatal intensive care and ventilation. She is credited with developing neonatal care to better the survival rate of extremely tiny preterm babies. For her work, the government of India has honored her with the third highest civilian award, that is the Padma Bhushan Award in 2014 for her contribution in the field of medicine and neonatology. Dr. Vasudha Apte, she is the first lady in the state of Maharashtra to choose forensic medicine and toxicology as a postgraduate subject. Also, she is the first lady medical legal expert in the state of Maharashtra. Along with that, she is the only lady in the panel of deputy coroners in the history of 125 years of coroner's court in Mumbai. She is the first lady to be the president of Indian Academy of Forensic Medicine and also the Medical Legal Association of Maharashtra. For her contribution in the medical legal field and medical education, she was awarded in 1995 as a Woman of the Year from American Biographic Institute Award. In 1999, Woman of the Decade from Medical Legal Society of New Delhi. In 2001, She was awarded with a Woman of Millennium from New Delhi. From Mumbai Doordarshan in 2009, Dr. Apte was awarded Hirkani Puraskar. In 2010, she was awarded by TN Medical College Lifetime Achievement Certificate. Also, G Marathi channel given her Unch Maza Zoka Puraskar in 2013. In 2017, Chitpawan Bhushan from Akhil Bharatiya Chitpawan Brahman Mahasangha Award. In 2018, Dr. Apte was awarded with Suprabhat Sahitya Puraskar, Noble Asian of the Year Puraskar, also Vishesh Pravinya Puraskar from Maratha Pratishthan. Dr. Mandakini Apte. She had completed her MBBS from the Government Medical College at Nagpur and later decided to her post-graduation in anesthesia in Government Medical College of Nagpur. She is a social worker from the Maharashtra. Along with her husband, Dr. Prakash Amte, she was awarded Raymond Magsaysay Award for her community leadership in 2008, which they work in the Lok Biradari Prakalpa among the Madhya Gaons in Gadchiroli district of Maharashtra and in the neighboring states of the Andhra Pradesh and Madhya Pradesh. Along with her husband, Dr. Prakash Amte, for her social contribution, they are also recently awarded with Padma Award from Government of India. And last and important is the Dr. Bharti Praveen Pawar. She was born on 13 September 1978 in the Adivasi region of Nasik in the Maharashtra. She completed her MBBS in 2002 from NDVP Medical College, Nasik, and from 7 July 2021, she joined the Indian politics and working as a Minister of State for Health and Family Welfare of India and was elected in the 17th Lok Sabha from the Dindori constituency. In December 2019, from Lokmat Media Group, she was awarded as the Best Woman Parliamentarian Award. Thanks for patience listening regarding the notable medical females